What is meant by bipolar affective disorder type 2? So we have two kinds of bipolar disorders. Type 1 means at least one maniac episode. 2 means if there is at least one hypomaniac episode and one major depressive episode, becomes type 2. Okay. Then a 30-year-old housewife has a fear for heights is classically acrophobia. Then which is not anxiety drug, anti-anxiety drug. Atomoxetine. What is atomoxetine out of this, doctor? It is norepinephrine reuptake inhibitor, which is used and recommended for attention deficit hyperactivity disorder. There is a remaining clonazepam, means benzodiazepine, sertraline, SSRI, fluoxetine, sertraline, everything, venlafaxine. They are all basically used in. It's also having a role in anxiety. Then neuroleptic malignant syndrome, antipsychotic drugs. For guiding lung biopsies, basically you will do CT guided fine needle biopsy. Ultrasound has got piezoelectric crystals. Oh, ये तो LKG वाला question है. Dawson's figures on MRI. Classically, what is Dawson figure? There is a corpus callosum, doctor. Typically, corpus callosum may, if you find this kind of a T2 hyperintensities, as you can see here, it's called Dawson. Now you may argue, sir, this is not demyelination, this is infarct. Infarct does not involve corpus callosum because corpus callosum gets bilateral vascularity. Unless bilateral vascular insufficiency occur, infarction doesn't occur in callosal area. Even an infarct can lead to a T2 hyperintensity, but it is unlikely in a corpus callosal area. So this kind of a hyperintensity in the corpus callosal area is basically called Dawson's figures, is what you see in multiple sclerosis. Vesico-ureteric reflux classically is MCUG, which is micturating cystourethrogram. Harmonic scalpel, as what you can see here, this is called harmonic scalpel. It uses the ultrasound. Thimble bladder, अगर TB options में है तो TB ही होना है answer. Tuberculosis of the bladder. This is an ultrasound image. I mean, this is basically a radiograph which is showing thimble bladder, and this is an ultrasound showing a small bladder, which is that fibrosed, cicatrized, small capacity bladder is the thimble bladder, is what you can basically see in these radiographs. Ramstead is hypertrophic pyloric stenosis. Other gested tumors may imatinib mesylate is used. If they become imatinib resistant, then what is the drug of choice? Sunitinib, which is the big brother of imatinib, is the one which is used. Sunitinib malate capsules are the ones. There are two places where they are used. Imatinib resistant gested tumors, and also in renal cell carcinoma you will be using the sunitinib. And in fact it is one of the first drugs now is the voice clear? Yeah, good. No monophonic voice, na? Huh. Okay, sure. WHO surgical safety checklist. आप honeymoon में जा रहे, you have some things to check while packing for honeymoon. So like that, there are some sign in, time out, sign out. Before induction of anesthesia, sign in. What are the things that should be kept ready? Then time out, then sign out. Basically it is a MSc nursing wala question hai. फिर भी डॉक्टर्स ऑल्सो शुड नो capsule endoscopy. What is just like e-learning, where you need not physically travel to the classroom. Everything now became electronic, right? So instead of passing endoscope, ask the patient to swallow a capsule endoscope. It will be traveling through the gut and taking tick, 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 tick. Next day, the patient will be defecating and passing it out. And they will be analyzing the pictures. In fact, that is the most awaited defecation patient ever had in the life, where anxiously the treating gastroenterologist and the patient both will be very happy if the capsule can come out, right? So, endoscopic capsule with lot of LEDs and camera lens inside it. But what is the problem? अगर stricture हो गया patient के पेट में strictures है, तो ये कैप्सूल जाके वो स्ट्रिक्चर में लटक जाएगा और 6 महीने लगेगा वो बाहर आने के लिए. It will be like Air Asia plane going into sea and you getting that black box. वो हो जाएगा situation. What is the most commonly used fixative? It is 10%. 10% वाला formaldehyde is what you need to basically remember. So what is one metabolic equivalent? Raj is saying answer for what? For the earlier question. Capsule wala question mein strictures are a contraindication. Now one metabolic equivalent is conventionally equal to 3.5 ml of oxygen per kg per minute of consumption is what you need to basically remember. Deep vein thrombosis maximum कहाँ होता है? Pelvic trauma surgery में. What even by Dunhill operation? If you do one lobectomy and the other subtotal lobectomy along with hysterectomy, one total lobectomy, other subtotal, that is basically called the Dunhill's procedure is what you need to remember. Domino procedure means what in heart transplantation, organ transplantation. देखिए किसी को हार्ट लंग ट्रांसप्लांटेशन किया आप, फॉर एग्जाम्पल की गॉट ए पूर लंग्स, so only taking lungs from a cadaver will not be feasible. So the cadaveric lung plus heart दे दिया इनको, मगर इनके दिल तो ऑलरेडी अच्छा है, तो इनका लंग्स खाली बैड है, इनका दिल तो अच्छा है, हार्ट इज गुड, बट फ्रॉम कैडावर ही हैज रिसीव्ड heart and lung. His lung is removed anyway, it is a useless lung, so you removed it. So he got the cadaveric lung, he got cadaveric heart also. Then his heart is there now, that can be given to somebody else who require only heart. Got it? That is called Domino's procedure. Got it? PGI चंडीगढ़ का चौधरी बुक है डॉक्टर, एम्स का मुदित करना है, आप मुदित करना पढ़ लिया, तो किसी को पीजीआई को जाने का तमन्ना नहीं है, तो उनको मुदित करना दे दे के आप चौधरी बुक ले लिए तो डोमिनो प्रोसीजर हो जाता है. दैट इज व्हाट कार्डियोथोरेसिक सर्जन्स विल बी डूइंग. ये लेडी 36 ईयर ओल्ड विथ ओवरी का है, सर्विक्स का है, एंडोमेट्रियम का है, देयर आर ब्यूटीफुल लोकेशंस फॉर स्टेजिंग. Examiner asking what is the staging of papillary carcinoma of thyroid? Impossible. Unless paper is out, you can't answer this question correctly. Or your luck factor should be good. So doctor, papillary and follicular carcinoma below 45, above 45, two different types of staging are there. Below 45 थोड़ा simple रहता. Stage 1, stage 2. अगर METS है तो stage 2, METS नहीं है तो stage 1. सिंपल. यहां मेट्स नहीं है इसलिए स्टेज 1, और जिसका उम्र 45 से कम है 36, अगर 45 से ज्यादा है उम्र, then stage 1, stage 2, stage 3, stage 4, nobody will ask this staging. Don't mug it just because it was asked previously. Okay, doctor. कभी कभी क्या होता है कि any institute is conducting DM entrance also. So examiner will pick up few DM questions and put in MD paper. DM oncology entrance के लिए this is very high yielding. MD के लिए too much. You'll get brain fever. Barrett's esophagus क्या होता है? Intestinal metaplasia होता है. Lower esophageal area is what need to be remembered. Sickle cell is transversion mutation. What is meant by transversion? What is transition? एक प्यूरिन पिरिमिडिन से रिप्लेस हो गया, वो होता है वर्शन. एक प्यूरिन का दूसरा प्यूरिन और एक पिरिमिडिन का दूसरा पिरिमिडिन, देन इट बिकम्स transition. So if you take the sickle cell anemia, there is a replacement of adenine with thymine, purine with pyrimidine, hence called transversion, is what need to be remembered. Once more, if you look at transitions, transitions are less likely to bring any mutation because एक purine का another purine in the ovule position में हो गया तो third position. Both the trinucleotides will code for the same. For example, GCA है. GCA became GCG. अगर ये हो या G हो, GCA, GCG will be same. मगर GCA and GCT will never be same. So that is the reason generally they don't lead to. There is a transversion, एक purine का pyrimidine replacement हो गया तो पूरा genetic code की भाषा और परिभाषा बदल जाएगा. इसलिए transversions are more severe in bringing the change in the genetic code is what you need to understand. Mentrier's disease होता है mucus hypersecretion with hypertrophic gastropathy is what you need to remember. Colonic cancer, most commonly sigmoid colon. This is a beautiful question, doctor. Superb question. I am waiting for this. अगर बच्चे children है तो ileocolic, adult है तो colocolic is what you need to be remembered. Postgonococcal stricture commonly is bulbar urethra. AV malformation is basically Duflois lesion. Then commonest nerve injured क्या होता है? Which one? Circumflex. Circumflex is the other name for axillary nerve. Circumflex is the other name for axillary nerve. Axillary nerve is most common. If you don't know, axillary nerve is also called circumflex, दिक्कत हो जाएगा. Adductor pollicis is supplied by ulnar nerve. Once more, what is the standard thing? Sunday exam में क्या आ रहे? Ulnar, radial, musculocutaneous, median. Definitely one question. Winging of scapula is long thoracic. Brown's tumor is hyperparathyroidism. Froment sign क्या होता है? Ulnar nerve. Bowler's angle, once more straight repeat, recently also Kerala PG, Maharashtra PG में आ गया. Bowler's angle is basically what? Calcaneal. Then one bone tumor will come, and osteochondroma is basically covered by what, doctor? Cartilaginous cap is what you have to basically remember. Then okay, infection of the flexor tendon of the index finger, it can go into the radial bursa. This is the radial side na, radial bursa को index finger से सीधा infection चले जाएगा. Kienbock's disease, one osteochondritis will definitely come. That would be lunate. She looks too pretty, try to catch her. So lunate osteochondritis is Kienbock. Then what is new bone formation basically? So you have lot of times this question is repeatedly asked, doctor. Bone formation, bone resorption markers. A table though you have to keep it in mind. Osteocalcin, alkaline phosphatase, bone specific alkaline phosphatase. These are all considered to be the bone formation markers. Abnormal adaptation का मतलब क्या होता है? Retinitis pigmentosa, vitamin A deficiency. Wherever rod deficiency is there, that lead to prolonged. Why not? Even primary open angle glaucoma may there is a atrophic changes happening in the retina, no, which will lead to involvement of rods, leading to delayed dark adaptation. Is what you need to remember. Contact lens का इस्तेमाल करने वाले आदमी में ring exudate is found. Classical of acanthamoeba keratitis. Retinoblastoma is, you must be sure on P versus Q. Q. Then blunt trauma in the eye में washes ring, Berlin's edema, rosette shaped cataract but not vis ring. Where do you find vis ring? Vis ring is found whenever there is any retinal detachment because of the persistent vitreous degeneration. So, in the vitreous detachment, typically that pulled out margin will form a ring when you do fundoscopy, which is then called vis ring, is what you have to basically remember. Now doctors, which drug has both mast cell stabilizing and antihistaminic effect? Superb question this is. So, it is olopatadine, but it is over the head question only by elimination. This is also called olopatadine hydrochloride. So, it is an antihistamine and also anticholinergic and mast cell stabilizer, and it can be used for allergic conjunctivitis very much. And if there is an irritation due to contact lens, there you should not use. In other states of allergic conjunctivitis, you can very much use it. Merciful anosmia, classical of atrophic rhinitis, otosclerosis, paracusis Wilsii. Oh, aa gaya, Trotman's triangle. If you remember, I think recent Kerala, Maharashtra, one of the mock tests we had same question repeated. Every examiner's ENT question bank में Trotman's triangle is a very standard MCQ. So doctor, bony labyrinth anteriorly, sigmoid sinus posteriorly, and the dura containing superior petrosal sinus superiorly is what you have in the Trotman's triangle, is what need to be remembered. What is meant by potato tumor? Potato tumor is the other name which is being given for the rhinophyma. Whom do you get this? Acne rosaceae. Recruitment phenomena, cochlear versus retrocochlear type of a deafness. What are all the differences? एक list table रहता है डिंगरा में, तो वो तो आप बराबर पढ़ना ही पड़ेगा. The second maturation division कब होता है डॉक्टर? काउंसलिंग के बाद, फर्टिलाइजेशन के बाद. Then living ligature होता है middle layer of the myometrium, and ovary develops from genital ridge. Endometrium regenerates from the zona basalis. These are all classical, easy to crack. You should not lose kind of questions. Placenta end with umbilical cord attached to the border is called battledore. Then most common site for the metastasis कहाँ होता है? Lungs. Then Gartner's duct basically comes from the mesonephric duct. Cleland is basically for what, doctor? In order to rotate in the transverse position, we use Cleland, Barton, Skanjuki, double application. So they are all the various types of forceps, because it is going to be few images in the exam hall. Cleland forceps कैसे दिखता जरा एक बार देख के जाना एग्जाम को, क्योंकि एग्जाम में इमेज बेस्ड क्वेश्चंस डेफिनेटली एक फोर्सेप्स आएगा संडे को. Delivery of the nuchal arms in the breech is accomplished by the Lovesitz maneuver. One maneuver, doctor, Morishali, Sivalivit, Roberts maneuver, corkscrew maneuver, etc., which is not a risk factor for previa. Crime is not risk, but smoking, age more than 35, previous curettage, etc. Mifepristone, it is not only used for medical termination or postcoital contraceptive or as an interceptive, but also it is used in Cushing syndrome is what we have to basically remember. I told you na, definitely one semen analysis ke bina examiner is restless in this country of high population. So doctor, how many strong sperms, how many running sperms, how many destroyed sperms because of the PG medical preparation continuously sitting in a non-air conditioned reading rooms and losing reproductivity and productivity. So you must be 100% sure on the WHO revised criteria of the semen standards. Definitely Sunday exam mein ek question jarur aayega. So what is meant by these definitions? Astheno means kya? The sperm will say, why this year, next year padenge gynecology, obstetrics, medicine, surgery. That is asthenia, right? Then astheno teratospermia. If less than 30% motility hai to asthenia bolte hain, and more than 60% abnormal form hai to you call it as teratozoo. दोनों है इस पेशेंट में, क्यों? इनका नॉर्मल स्पर्म्स मॉर्फोलॉजी 30% मीन्स एबनॉर्मल 70% है, which is more than 60%. Hence he comes under teratospermia. Astheno because motile sperms are less than 20%, 80% are non-motile and useless. So that's what you need to basically remember. Face presentation में submento brachmatic is in face. Similarly, you must know all transverse diameters, diagonal conjugate कितना होता, maternal pelvis and fetal skull का complete tail ring measurements, 34, 36, 38, what is the size of the hip. So पूरा पढ़ के जाना. Fitzhugh-Curtis syndrome में gonococcus will be there. Then genital fold से labia minora will be developing. Then non-reactive, non-stress test hai to what is the next thing? You need to do biophysical profile in order to know the fetal. Option D. कहाँ है वो रिकमेंडेशन? 2 बार करो और बाद में देखो. कुछ टर्म जेस्टेशन है ना, सो वन मोर नॉन रिएक्टिव का स्कोप नहीं मिलता. अगर टर्म नहीं है तो 1 वीक वेट करके कर सकते, और एक रिपीट करके फिर भी वो भी नॉन रिएक्टिव है तो कर सकते. आई एम नॉट श्योर अबाउट दिस बोथ रिकमेंडेशंस, प्लीज रीचेक. आई डिडंट रियली गेट टाइम टू प्रिपेयर इट. बनाना साइन, basically you have in spina bifida that elongated part of the neural tube defect will give that cerebellum looks like a banana, which is not a part of struma ovarii. In banana sign in spina bifida. एनएनकेविली में सर ही नहीं है, सर के अंदर दिमाग कहाँ है? यहां सर है, दिमाग है, मगर स्पाइनल कॉर्ड में प्रॉब्लम है, इसलिए वो एक्सटेंशन ऐसे दिखता. सो थायराइड टिश्यू विल बी देयर, इट विल बी कोलॉइडल एंड इट विल बी बिनाइन बट नॉट सिस्टिक. देन व्हाट इज लेवल 2 सपोर्ट ऑफ यूट्रस? इंटरेस्टिंग क्वेश्चन. यूट्राइन सपोर्ट्स इज ए हाई यील्डिंग टॉपिक. वो तो है. There is something called the Delancey's 3 levels of pelvic support. 3 लेवल पे सपोर्ट मिलता है. फर्स्ट इज द कार्डिनल यूट्रोसैक्रल लिगामेंट विल प्रोवाइड द अटैचमेंट टू द यूट्रस एंड वेजिनल वॉल टू द बोनी सैक्रम, एंड दैट इज कॉल्ड फर्स्ट लेवल. पूरा facial attachments होते ना, which are overlying the levator muscles, they provide level 2. The urogenital diaphragm and the perineal body, they provide the support, which is then called level 3. So don't forget Delancey's 3 levels of pelvic support. You won't be surprised if a same question comes back the Sunday, which is not used in distending the hysteroscopy. They use carbon dioxide, glycine, saline, all the 3. Then highest number of questions come from ectopic pregnancy, doctor. At what point of HCG levels you will find a gestational ring? Transvaginal ultrasound versus the transabdominal ultrasound. Everything you must iron out. Okay. Then human papilloma to one type of vaccine, HPV vaccine के ऊपर question आएगा, and that would be 16 and 18. Below 3 years you find yolk sac tumor. So these are, I think some more questions are there in SVIMS 2015. We will use them in another mock test. So we will go to the SVIMS 2014 questions.